Hello viewers, welcome back to my channel Manas, a pursuit of happiness, and this is your Dr. Chitra Aravind. So in continuation to the previous videos on this very important mental health series, today I am going to break a lot of myths and also give you a lot of tips to understand and overcome the stigma which are related to other mental illnesses. And the most educated people also don't know a lot of things about this mental health issues. So it's very important that we all understand what really is a mental health issue and how one experiences this particular problem when he develops this kind of symptoms, and also to really understand whether it's a treatable one or not. So in this video you'll be getting answers for all of this. So try to watch this video till the end, and please do share this video for people to understand and help spread this awareness about mental health for a more healthy and a happy society. Okay, so here when I talked about myths, most of the times the mental health issue right from the decades ago, it has been always correlated with witchcraft and also black magic, because especially in one of the mental disorders, that is schizophrenia. There is a mental disorder called schizophrenia, and the symptoms are like hallucinations and delusions. So where people start hearing voices and also see some images. So when they start developing this kind of weird symptoms, so-called weird symptoms, so people generally mistake it for some issues, related to this black magic, or somebody has done something to them, and all related to the religious connotation. Even in at this juncture also, this kind of thing is happening. Please don't think that this kind of misinterpretations are happening like 20 years ago, 30 years ago. No. Even now I am having clients where people have gone to all these kinds of resorts, to a lot of temples, be it a Hindu or a Christian or a Muslim, whatever religion you follow, people are still believing this to be related to some religious curse. And then after, when treatments doesn't work, that kind of religious treatment doesn't work, they come back to a psychologist or a psychiatrist. So it's high time that we understand and break the myth. And one more important myth that people usually think that mentally health people are actually mentally weak people. Only weak people develop this. It's again wrong. So it's not about your mental weakness or something, because mental health issues are caused because of various reasons like biopsychosocial reasons, and because of your biological vulnerability, and because of various other factors which are playing in your life. So it's not necessarily that a mentally weak person develops this mental health issues. It can even start from the newborn baby until the old age. So we can't say it's just mentally weak people develop it. And for some people think that irresponsible people develop it, and people don't, they did not have this proper upbringing, and just because this parenting is not good, so they develop. It's all a myth. And even it's very unfortunate to hear from even the most educated people that psychologists and psychiatrists are the ones who treat mad people. And no more we are using this term mad anymore. So we don't call it as a retard or mad. It is again just like a physical health issue, mental health issue is also a disorder. That's all. We need not add any stigma attached to it. And for a long time, even when I started the clinic also, people were really coming in a more hush-hush way and not wanting to talk about that. No, I visited this doctor. But when you go to a treatment for cholesterol or for diabetes or something, even people when they meet at park, they say my diabetes doctor, why don't you go to him? But no one says like, do you know my depression doctor? Would you like to get a referral? Now it's starting very slowly to starting this trend. But then long back, or even at this situation also, the things are not changing in a more positive way. So I think we need to break the stigma. And people believe that those seen on the streets with the rugged clothes and people who are not very hygienic, and those are the ones who are like mentally ill. Not really. 1 in 4 people whom you come across in your work, as well as in the way, on the way where we travel, and also where you, let's say in your family, in your societies, in your neighborhood, among your relatives, you can find a lot of people suffering from mental health issue. But the thing is, they may not be telling you, or they themselves may not be aware of it. So the statistics and the researchers, they have proven this, and it's very common. And it's not like what you imagine or what they portray in the movies, like mentally unhealthy people laugh, or they are very dangerous and they kill other people, because a lot of social media is showing that mentally unhealthy person killed a lot of people and they are so dangerous and this is such an untreatable one. Not at all. they look very normal. As I told you, they can be one among your colleagues also, work colleagues also, and you can't really figure out whether they are having mental health issues because it's highly invisible. It's about your internal processes, how a person think, feels, and sometimes only it is shown very visibly in certain disorders. Otherwise, you really cannot get into the person to understand whether they are having some mental health issues. Only when it becomes so severe, and in certain disorders like schizophrenia and manic psychosis, people can really figure out something is wrong with him or her. But otherwise, it's generally not that visible. That's the reason when let's say like your arm is broken and you have fractured your arm, and you really will be rushed immediately to the hospital because immediately the first aid has to be given and treatment has to start. But at the same time, when a person in your family says that, "Mom, I'm so depressed and I cannot go to college today, and I've been having these bouts of crying, and I feel like I'm so lonely and I feel the deep regrets in my life." But then we say that just go out, meet friends, and come, let's go to pray God, and you'll be fine, cheer up. All these are the advices we immediately give. We don't understand the intensity and gravity of these disorders just because it's invisible. Just how we go to a doctor whenever we develop symptoms of temperature, 99 degrees, 100 degrees also, we just go to the doctor and get treatment, come back, because we can't just experience this pain anymore, right? But similarly, when a mental agony is felt, when a mental pain is felt by any individual in your family, we just dismiss it by saying that you will be fine. Just listen to music, pray God, it will be fine. But high time people should understand the pain which is related to the mental health issues. Only when you experience, the pain which is attached to it. Lot of agony, lot of emotions are tied up with it. And people who undergone depression and other major disorders only can tell you that. Even when they express, you won't be able to understand that unless when we experience it. So we need to have empathy for these people, and also I'm not saying like necessarily you should sympathize and empathize with these people and treat them as one among you and really give them this medical support when needed. And we just can't say that only when it becomes severe I'll take you to the hospital. It is very important to treat any mental health issue in the beginning itself to avoid any severe consequences, because mental health issues can have a lot of deleterious consequences on one's family life, their married life if they're married, because a lot of clients whomever I meet for marital therapy or a couple therapy, and I figure out them having some mental health issues already at least for 10 to 15 years, you won't believe it. But then only when it cropped up in their marital issues, they come up for treatment. Similarly, people who go in the hands of law enforcement, let's say a person who has committed this homicide or who has stolen a lot of money from the bank, later we come to know that they are like having this antisocial personality disorder, or they may be psychopaths. So, but then we don't know until then that they are mentally disturbed. So only when problem goes out of hand, or in typical cases like manic psychosis or schizophrenia, when the symptoms are so visible where they laugh, they talk to themselves, and they start hearing voices and they start disturbing people, then people know, okay, there is something really wrong. Only in such circumstances people come. Or maybe in case of anxiety disorders, when it is really debilitating for the person who is suffering from anxiety issues and panic attacks, they themselves come for treatment. So except for these few cases, otherwise people don't seek treatment. And researchers have found out that there is 70% treatment gap, and you will be surprised to know that more than 20% of Indian population might suffer from any form of mental illness, but we just don't have mental health professionals ready and prepared and well equipped and trained to treat these people. There is a lot of gap here, and people who are suffering, they don't come for treatment also. My question is, why we need to live with this pain? Because when we have a slight pain in our finger also, we just go to a physician and get rid of it and then live a happy life, at least a peaceful life, and then pain-free life, I would say rather. But then whenever you have this kind of mental agony and a grief, and you can't get over your grief because you lost your loved ones beyond 6 months, still you continue feel the pain, and then you have this anxiety issues, and you have this learning disability issues, whatever mental health issue may have, but still you feel like, okay, let's say like it'll go off by itself, maybe it's just a transient period and everybody feels so, and you just brush it off and you just ignore it, you are actually destroying your mental peace, and also definitely not living the life which is really gifted to you. So why don't we just seek a treatment and get rid of this mental health issue and go forward in our life? Because when it is having a various impact on our family life and also work life, many researchers have also found out that more than 40% of the working professionals are suffering from stress related issues and also generalized anxiety disorders. But then how many corporates have this kind of mental health professionals in their premises, or at least through the phone call? They don't have. Whenever I go for workshop, I figure out many professionals suffering from anxiety and other depression issues, but still they don't come forward for treatment because of the stigma which is attached to it. Oh, this person, Mr. X, has gone to a psychologist. What could be his problem? So this is the talk of the town, and high time we need to break down the stigma and also understand the mental health issues in the right sense, breaking all the myths which are attached to it. It is not due to any curse, it's not due to any lack of morality. Whenever people get it, they say that what is the sin I've done, why should I suffer from this? It's definitely not because of any sins, because when they say cancer, usually it's actually associated, it has got a lot of stigma and associated with moral sins and curses. Similarly, mental health problems also are thought in that way. Definitely it is not because of your sins. It is because of the psycho-biosocial, maybe you're genetically vulnerable, or because of your personality, or for various factors you are getting this, and it is a treatable condition. Majority of the mental illnesses are treatable, and it shows lot of improvement with early treatment and interventions, the right interventions, diagnosis and treatment. But then people don't understand that, and they just want to live with this suffering. So high time we need to think about it, and only when it affects various areas like family, work and elsewhere, then people just step in for treatment. Even very educated people, I would say, they brush it off saying that, I don't want to get treatment, I am fine, I can manage it myself, I can cope with it. But beyond a point, you cannot manage it all by yourself. You need treatment. So now I've just been talking about mental health disorder. Here and there I told three terms like anxiety, depression, schizophrenia, but generally we see in Hollywood, Bollywood and Kollywood movies about these mental health disorders, mostly about depression. Depression is one term almost everyone would have heard about, but there are other 250 types of categories given by DSM, that is Diagnostic Statistic Manual, and also there is one more manual, that is ICD. So we have such diagnostic manual which talks about various mental health issues people can develop towards their lifespan, that is starting from the time we are born until our death. But then how many of us are aware of the symptoms and signs of these disorders? Just because you're not aware of this, people are not coming for treatment and just have to live a life which is very difficult for them, their own selves. And also in cases of personality disorder, where life is going to be hell for people who are living with them. For them it's not a problem. For people who are living with them, let's say the spouses, or let's say the siblings, or let's say the parents who are suffering because their children or the person in the family is having this kind of personality disorder, especially borderline personality disorder or antisocial personality disorder, many other disorders, such disorders are there, who cause problems to other people and not to themselves. So, and they also don't have any insight that they have problems also. So, lack of mental health awareness has led to all these miseries in life, and because of which there are a lot of financial losses a corporate has to face in terms of working professionals and in family, loss of loved ones and suffering every day, and a lot of divorces and breakups, and children suffering because of poor parenting due to the mental health issues in their parents. And also mental health issues in children, schools where they are not able to cope up with this kind of children. So everywhere it has got a major impact. So high time we should understand about at least the major mental health issues and be aware of the symptoms, so that when you or your loved ones develop such symptoms, it is important to figure out whether they are having some mental health issues and seek right treatment at the right time with the right professional. So in the forthcoming videos, I'll be talking about the symptoms of mental health issues and whom should we contact. All these details will be seeing in the forthcoming videos. So please stay connected in this mental health series. Have a nice day. Take care. Bye.